Eddie Cabri here, Cabri Plastic Surgery. I hope you're well. Today's patient story, 2 thumbs up. So extensor tendon lacerations are extremely common injuries that we encounter as hand surgeons, and most often this is from trauma, but sometimes it's from inflammatory conditions, overuse, and also some rare anatomic abnormalities in which there is a rubbing attritional type phenomenon. So this 39-year-old right-hand dominant laborer was using a bandsaw when the bandsaw slipped and lacerated zone 2 of the right thumb and the radial side of the index finger, as shown here, when he presented to our emergency room. And so in the emergency room, the wounds were irrigated out, the skin was temporarily closed, and he was referred to clinic. X-rays were, of course, performed, which were negative for any fracture, dislocation, etc. Now, what you can notice from these photos from the emergency room is that the thumb is held in a fixed flex position. The patient is unable to extend due to the unopposed action of the flexor pollicis longus, with the extensor pollicis longus having been lacerated. So I saw him in the clinic the very next day, and here's my examination.
So bandsaw injury yesterday, striking the dorsal right dominant thumb at the level of the P1, and also along the radial aspect of the index. He has, let me see your index again. Can you go full up and make it, bend it all the way? So no numbness or anything here.
No.
And what happens if you try to straighten your thumb out? Lift it up. Okay, so he is MP extension, but no IP extension. And relax it, and then straighten it out. Big thumbs up, big thumbs up. Okay, and relax, good.
And again.
Okay, and then thumbs up for me as best you can, thumbs up. Okay, and relax. And then thumbs up as best you can, and relax, good.
So you can really appreciate there's no extension of that IP joint. The EPL is clearly lacerated. So I went ahead and took him to the operating room that same day, that evening. Now, time sensitivity really matters here. It doesn't have to be the same day. The data really shows that 1 week, 2 weeks, within a reasonable time frame from the injury is optimal for outcomes. And it's actually critical because if you wait too long, say beyond 2 weeks or so, tendons can retract, scar tissue can develop, and other techniques are then required to achieve a repair other than a simple primary repair. So I took him the same day. I irrigated out his wounds. I did a repair of his extensor tendon. And my goal with these injuries is that several years out from this injury, patients don't even remember which tendon was injured. That's the kind of level of outcome we want as surgeons, of course. But really, this requires at least 3 things. You have to have good technical surgery, but you also need compliance on the part of the patient to wear splints and casts and so forth, and you have to have a good hand therapist, hand therapy team guiding the patient through, and this patient had all of those, so it lends itself really well to a good outcome. So how did this patient do? Well, here he is at 2 weeks out. You can see his sutures are still there. He's healing up. Here he is at 6.5 weeks out. Cast just comes off here.
So now we are 6.5 weeks out from repair of an EPL laceration of the thumb. All right, let's see what you got. Can you bend your thumb down like this? Bend, 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 and straighten out for me. Good, I'm gonna hold you like this. Can you bend it? Just the first time, just out of the cast and straighten it out. Nice, and bend again, and straighten out. Excellent, okay. And can you touch each of the fingers? Yep.
So you can clearly see that the repair is intact, but there's some stiffness as would be expected there. And finally, my longest term follow-up at 3 months.
And 3 months out, EPL laceration. This was skin and soft tissue. It fortunately did not impact his nerves or his tendons there. Let's take a look at your thumb. Can you straighten up for me? Yep. And then down. Excellent. And then thumbs up. Wonderful. I'm going to hold you here. Bend down for me. And then thumbs up. And then bend down. And thumbs up. Fantastic. And there's your laceration.
So really a fantastic outcome with complete extension flexion at 3 months. So I hope you enjoyed this patient story of 2 thumbs up. As always, make sure your surgeon's board certified. Ask for pre-op and post-operative pictures. We'll see you for the next patient story.